As president of the World Medical Association, it is with great concern that I see the high number of attacks on health professionals in various parts of the world. We have recently even been made aware of a case in the state of Rajasthan in India where law enforcement officers have been involved, resulting in a leading female physician committing suicide after the tragic death of her patient. Following the suicide of the physician, I've written to India's Prime Minister Narendra Modi, urging him to stop the high number of attacks on physicians and other health personnel in the country. The fact that a woman physician committing suicide following the interventions of law enforcement officers and legal action after the death of one of her patients pictures the tremendous personal risk and unreasonable pressure that physicians face caring for others. This is neither reasonable nor sustainable. It must be clear that any treatment outcome that is detrimental or fatal must first be properly and professionally examined before conclusions about civil and criminal liability can be made. Utmost attention must be given to an unbiased, scientific correct process in dealing with unwanted treatment outcomes. I'm shocked by the involvement of law enforcement officers in such cases. This is an apparently ambitious legal situation. The WMA therefore support the Indian Medical Association in their request to the Indian government to enact an ambitious and effective lawful means to stop the attacks on physicians and other healthcare personnel. Countering non-negligent treatment errors with prosecution in the first place is not only unjust, but will also have grave consequences for the treatment of the population, as it will lead to risk-avoiding defensive medicine and, as such, to reduce treatment options for seriously ill or endangered patients. I therefore call to provide a legal environment and law enforcement that allows health professionals to do the best they can for their patients without being under threat of violence or persecution.